gloves on. So you have to practice using tape with gloves on. And I'm going to put that on top of my... Somebody just called me? What's the problem?
I know you're not supposed to let go, but...
No, I'm not letting go. Okay, well, sure you can see, because all I'm doing is putting this on top of my underwear. Look at where I'm putting it. I'm not putting it in any strange place. Yeah, well, why would I put it any other way? Why do I want to put it this way? Because I want to take these little pants legs and wrap it around my tubing to hold it into place. And they are easy to remove, unlike the other one I had that stuck all over my gloves. Now I can take another piece of tape because here, let's do this right here. I'm going to move this down some so I have more room and it's easy to come off. Move this down a little bit. You need to have your pants leg at a certain length and wrap it around to secure it to the tube. Spiral it around the tube, please, and then wrap it around this way. And if you're uncomfortable with that staying on, you can put another piece of tape on top of it. It's fine, okay? Now, I'm going to stabilize that by putting another piece of tape on top of this to secure my pants. And we said that was our belt. And I'm going to tear myself another piece of tape. Thank you, Mo. The thong size, so I can wrap it around my little pants legs to hold this in place. Because I didn't tear my pants legs long enough. So while you're... Thong. Thong.
Oh, I'm sorry.
How about y'all tell him what to do?
So the only tape on the tube right now are the pants legs?
Actually, this is supposed to, yeah, and that's all you need if it's long enough. And I'm telling you, I didn't tear mine long enough because it stuck to itself. So I'm saying just put another piece of tape on top of it. At this point, I really should, look, it's firm. I'll tear it myself. Thank you so much. But I'm going to put myself another little securing piece of tape on top of that to make sure all is well. So I know it's stuck on tight. The first, just one pants leg helped to hold it in place. Two do even better, okay? Now, I'm going to, so I've changed my tape. It's not pretty, but it's working, okay? I have this up. I'm going to tug a little bit, make sure it's working correctly. And then I'm going to do my mouth care. And I'm going to end up by putting some KY jelly on the patient's lips. When I put lemon glycerin swab, I will put that back in my cup of ice on the patient's mouth. What I'm going to do is to go in and clean the sides and the buccal areas. What's the buccal? Inside the cheek. You know where they checked you to see if you had a baby out there, men. And to check to see if you have what? HIV. The HIV test. And I'm going to clean underneath, sweep across underneath the tongue and across the tongue. I am never going to approach this person and do this midline because what are they going to do? Gag and puke. We're not going to do that, okay? No gagging and puking. So, and we're going to clean around the gums, up the top and the bottom, and I'm coming out, and I can throw that into the trash. Thank you so much. And the last thing I'm going to do is put some KY jelly on the lips. Okay? Now, is this a part of the test? No. What's the test? Do the NG tube care. Change your tape, clean the nares, put a little bit of KY jelly around the outside and just at the entrance of the nares. Okay? And of course, change the tape and clean the tubing. I did the mouth care because they need it. All right? Or I would give them a toothbrush and toothpaste and tell them to brush their teeth if they were alert and oriented. We have patients in the hospital all the time who are alert and oriented with the NG tubes down. And I would make sure this tube is in the up position. And the last thing I'm going to do is tear a piece of tape and secure it to the gown, which is really not securing, but that's what they tell the students, so it's good. You can let the tube go free flowing. And listen, the way you do this is loop it around the tube to hold that in place. and tape it to the gown. Okay? That's in an up position. It's closed. We change the tape. We clean the nares. You can use a washcloth. You can use gauze. You can use cotton balls. Squeeze it out. Water only. No soap. Clear water. And put the KY jelly or lubricating jelly around the nares and then on the lips. And clean the mouth with the what? Lemon glycerin swabs. Nice and cold, please, because they stimulate salivation and moisture of the mucous membranes in the mouth. Then we secure it to the gown. We do not use a pin because you might stick somebody. No pins in the hospital because the crazy people did something with it and now we can't have them anymore. Okay? If this was secured to suction, this would be off here, connected to tubing over here, but you cannot leave it open. NG Tube Care.